So now we're going to turn it over to Dave and Sue to hear their story. So I'll turn it over to you both now.
Hi.
Hi, thanks for having us. We're sharing our difficult story, so hopefully of our experiences, and we can learn from some of yours and figure out how to do this better. Our Ben has ME/CFS. We're not using Ben's real name. He's really asked us to respect his privacy in this process. But Ben's symptoms began in December of 2020 and from a concussion. He spent most of his time laying around on the couch as a teenager. And the concussion clinic really advised and pushed for active aerobic exercise as his therapy, which we supported, and he found to be absolutely torturous. The only relief during this period came when he took 2 weeks completely off from school and around one of, they had a week break, but then symptoms came back after just 1 day of school.
In March of 2021, his concussion neurologist told him symptoms were no longer concussion related. And after ordering an MRI, which identified no abnormalities, just discharged him from that practice. Our pediatrician referred us to an endocrinologist to check for Cushing since Ben had Cushionoid symptoms. But Ben's cortisone was in normal range, so we were sent back to the pediatrician. Meanwhile, Ben was missing a lot of school and being accused of school refusal. So with no diagnosis in hand, they said he needed no medical diagnosis in hand. They said he needed to be in a program or in school. So he attended a partial day program via Zoom for teens with anxiety and depression for the last 2 weeks of school. He did seem better for that versus school.
We ended up traveling a lot that summer, and Ben crashed terribly during the trips. Even though we by then had been started using a wheelchair, we had bought our own wheelchair, and we tried to limit his activities as much as possible. We didn't understand what was happening, but through Google and everything else, we started to suspect chronic fatigue syndrome. Our pediatrician found and referred us to Boston Children's Complex Care Clinic, and we had our first appointment in August. That physician diagnosed Ben with ME/CFS and gave us Dr. Rowe's pediatric primer to read. We finally felt listened to and hopeful. We asked about getting a prescription for a wheelchair that Ben could use and felt it wasn't necessary and was confident that Ben would end up be up at, although she did advise us that it was slow medicine. The doctor also recommended bupropion, which helped with energy, but Ben then became severely anxious and was unable to sleep. So we were also referred to cardiology and neurology. Ben started school that September in 2021, this past September, rented on our own, and an accommodation from the load a quarter of the normal load.
After just 2 days, crashed so severely that he is bound, and he basically has been since. His condition has worsened progressively with orthostatic intolerance and a host of other new symptoms. I'm sure many of you could name them off the top of your head. Got the first cardiology visit that doctor had recommended in October. The cardiologist prescribed fludrocortisone, but lectured Ben that there was no reason he couldn't be walking around. And they recommended physical therapy, which we declined. And Ben was actually frustrated that we seemed to be arguing with the doctor. The neurology visit was 5 months out, and we never saw that neurologist.
Last fall, Ben had a particularly bad night where they had they were saying that they felt paralyzed, that they couldn't move their arm. And their speech was becoming slurred and slower. And we were terrified that he was having a stroke and ended up calling 911. In the emergency amount of time that it took for us to get there, Ben started to feel a little bit better. And the attending really just treated Ben in a very condescending manner and really made light of their difficulties walking. We were given a diagnosis of functional neuropathy or neurosis, something, and referred to a neurologist. So we got in to see a neurologist, not the original, pretty soon after that ER visit. And their focus was really functional neurology. We discussed the ME/CFS diagnosis. And this neurologist claimed that the only evidence-based treatment for it was graded exercise therapy, which we politely said wasn't. She initially agreed to order scans to evaluate CCI, but she told us she didn't believe in those diagnoses, and she changed her mind about ordering the scans after we left her visit.
All the doctor's visits and tests exhausted Ben even more. In addition to bloating and exhaustion, Ben was complaining about severe pain. So in late November, we reached out to our pediatrician, describing the bedbound status and pain. The pediatrician was alarmed, contacted the children's hospital specialists and Ben's psychiatrist, and they jointly told us they wanted to put Ben in the hospital for inpatient observation. When we asked what the plan was, they said that would be made by the attending physician, likely involving observation of the post-exertional malaise, psychiatric evaluation, and visits by neurology and other specialists. They kept on telling us how rare Ben's illness was. We let them know that we didn't think an inpatient stay would be beneficial for someone with ME/CFS, and we referred to Dr. Rowe's paper. We were concerned that we were being perceived as parents who were withholding care for Ben. We were concerned that we might be forced to admit Ben to the hospital. At this point, we reached out to MassME, which felt like a lifeline during this stressful period.
We pleaded, as we actually had been for a while, with a physician for a physician-to-physician consult with Dr. Rowe. Our pediatrician finally agreed and had a long conversation with him. She withdrew the recommendation for the hospital admission and called us to let us know we should talk after the holidays and develop a plan. At the follow-up, she let us know that Dr. Rowe had given her advice about Mestinon and low-dose naltrexone, some of the therapies we were asking about, but she didn't feel comfortable prescribing any of those things. And she recommended we see another cardiologist and also mentioned a doctor in Rhode Island that might be willing to prescribe low-dose naltrexone. We left that visit without a plan and feeling totally abandoned by our regular pediatrician.
We saw a second cardiologist via telehealth who was more empathetic, but told Ben that his psychologist should be a coach to help him be more active. He didn't have any experience with ME, and we haven't met again. Fortunately, we had connected with a physician in Northampton on recommendation from Rivka from MassME. Hi, Rivka. He has some other patients with ME/CFS, although no pediatric patients, and has been willing to listen and take Ben's illness seriously. The visits are via telemedicine, and after the initial one, we have a call every 6 to 12 weeks. So it's critical for us to prioritize the issues in order for us to make sure we're getting to the most important ones. We also need to slow the physician down sometimes so that Ben can follow what's being said. He continues to be brilliant, but his processing time is slower.
As parents, we're still worried that Ben's not under the care of a physician who actually sees him in person and can do a physical exam, but at least he's being treated. We're still looking for ME knowledgeable specialists who will treat patients under 18 in the Boston area, and looking in particular for help with sleep and dysautonomia. Lessons that we'd like to share, which I think many of you already know, and maybe we learned from you, are, don't waste too much time with physicians who are not willing to understand. Get accommodations early. By the time we got a wheelchair and a stair lift for Ben, it was really too late for him to use them. He was too exhausted already. Be willing to respectfully question your physician's advice, even if it doesn't make sense. If it doesn't make sense with what you know about ME/CFS, and really get support from other patients and parents. We've turned to this group into a Facebook support group for parents with kids with ME to get better insight into treatments, providers, and just validation when we weren't getting it from the physicians. And this has been important even with a physician that's been really terrific to work with. Sometimes the treatments that he's prescribed, we've needed to get some insight on how best to implement. Prioritize symptoms and questions to be able to take best advantage of the limited time that you have with doctors. We find that we have a planning meeting where we write down what we want to ask and are in agreement with our son about what's important to him. we hope that groups like at MassME can go ahead.
Succeed in fostering relationships with physicians and the professional organizations to educate more doctors as well as the general public about this illness. And we hope that can result in care that's better suited to this illness. For example, more possibilities for home visits.
And we really also hope there's just more support for primary care physicians. I just feel like our pediatrician really tried, but at some point she just felt overwhelmed and gave up. And then we didn't really have anywhere to go.
All right. Thanks.
Well, thank you so much for sharing your story. I know it's a difficult story, but I think that almost everyone on this call, if not everyone, can really relate to at least one aspect of your story, whether it's having trouble communicating with the doctor, having them take them seriously, having them believe them, so many different things. So I'm really appreciative to you for sharing your story today.